Okay, Dan, welcome to the show.
Hello, Oran. Thank you.
Whereabouts are you in the United States?
I'm on the west coast of the United States in Seattle.
Okay, so can you tell me quickly, what is Toyohari?
Toyohari is a form of meridian therapy acupuncture, and the name itself just means East Asian needle therapy. As meridian therapy, we primarily focus on the relative strengths and weaknesses of the 12 main meridians.
So it's very much based on channel theory rather than organ theory.
That's correct, yeah. Rather than the Zongfu, we're focusing on the 12 main channels. And also we do have a treatment in our branch system for supporting or treating the 8 extraordinary vessels.
Hmm. Okay, and what's your background in Toyohari?
I first got introduced to Toyohari in 1994, actually, but in 1995, 4 of the senior instructors in the Toyohari Association in Tokyo came to the 3-day weekend. After that, we were all very inspired, and with Stephen Birch's help, there was a program that was set up in Seattle beginning in 1995, the first 9-month, 18-day program in Seattle. So I've been studying and practicing Toyohari ever since.
Okay, can you tell me what's unique about Toyohari? What makes it different?
Well, again, as a meridian therapy system, the main focus is on the 12 main meridians rather than the Zongfu. So theoretically, it's very simple. It's not the complex syndromes that you might find in TCM or Zongfu focused practices. And nor is it only focused on points. So it draws its information from 3 of the main texts, the Suwen, the Lingshu, and the Nanjing. What's unique about Toyohari versus other meridian therapy systems, I would say, is a very careful and very delicate needling techniques that we develop and that are always being refined over the years. Um, and also very careful attention to delicate, light, and perceptive um, uh, reading of the patient through palpation, through observation, through listening, etc.
So, from what you're saying, if it's based on treating the channels all the time, then you must be palpating the channels all the time. Can you tell me a little bit about that and also how you go about locating points?
Yes. So we use what's called the 4 exams of diagnosis, and that would be looking, listening and smelling, asking, and palpating. Palpation includes abdominal palpation, meridian palpation, and pulse palpation. We are using all of this to assess the relative strength or weakness of the 12 main meridians. So we can get a sense of that even by listening to someone's voice, their vocal quality, their vocal tonality. We could get a sense of that by looking at the colors on the face between the eyebrows or off to the side on the forehead or on the inner forearm. So palpating on the skin of the inner forearm where the sun and makeup doesn't affect the color. But primarily, we get a lot of the information from palpation, and especially abdominal palpation, meridian palpation, and the pulse palpation. Um, when we're doing this, we pay very careful attention to very light and subtle differences in the skin quality on the abdomen or the meridians that we're checking. So we might look and find a dry spot or a raised hard spot. Maybe it's a little sunken. Maybe it's puffy or moist. So there's various differences that we could feel on the skin that indicate whether it's more deficient or more excess. And this could be found on the abdomen. And on the abdomen, we look at main reflex areas, so areas that relate to the different meridians. And we could also say they might relate to the organs. And then on the meridians, we're checking primarily along where the source points are. We might look where the low points are on the meridians, or we might even palpate a large part of the length of the meridian to get a sense of the general well-being or health of that, the deficiency or excess of it. The pulse diagnosis It's a whole different ball of wax, so we could discuss that separately if you'd like. All right.
Okay.
Of course, the most important unique thing about Toyohari is that its founders were blind practitioners. Mr. Fukushima Kodo, was blinded during World War II. He was put on the front in Manchuria, primarily as punishment, they say, but was shot in the head. After his recovery, he wanted to study acupuncture, and after much searching, his wife saw an article by Okabe Sodo, who was one of the founding members of the Meridian Therapy School at that time. Now, the Meridian Therapy School got started in the 1930s when a group of practitioners didn't like the direction that acupuncture was going in. There was a lot of influence of Western style medicine, and acupuncture was losing its traditions and its theories. And so there was a charge to reread the classics, famous Return to the Classics by Yanagiya. And then so this group was formed, a study group was formed to reread, particularly the Suen, Lingshu at Nanjing, and other books, in order to understand the foundation of this medicine, and then try to see how they could utilize that information in contemporary clinics, in their own clinics. Well, when Mr. Fukushima saw this article by Mr. Okabe, he got very excited and realized or recognized that this was the style of acupuncture he wanted to study. He went to them, to their group, and they told him, well, I'm sorry, you're blind, and therefore you can't be a part of this study group. For one thing, the classic texts were not translated into Braille. You need to get them translated into Braille. And why don't you form your own study group with other blind practitioners, and we'll guide you along the way. You could come meet with us, and we'll interact with you and help you in the development of your system. And so he did just that. He and a close friend, Mr. Kozato, and 3 others, so there's the 5 phases, formed their own study group of blind practitioners, and got the classics translated to Braille, and started to study. And we're going and getting guidance from the original Meridian Therapy group as well. Along the way, they realized that there were certain things that they were doing that might be a little distinct. And because they were visually impaired, they had developed a different sense of perception in their hands. There is a great degree of facility for proprioception that these practitioners developed. And it's really remarkable when we work with our teachers to this day who are visually impaired, their ability to pick up information tactily is just remarkable. So that's a key difference. Now, in Japan, ever since Waiichi Sugiyama developed the first schools for the blind in massage and acupuncture, this is not uncommon to have blind practitioners. And this was in the 17th century. And so forming a study group and then a whole system of acupuncture amongst blind practitioners is not unheard of in Japan. Toyohari as an organization, the first association meeting of Toyohari was in 1959. So that's how long it's been around.
I'd like to add one more thing about Fukushima Sensei, who was the founder, as you say, of the Toyohari Association, is that he was a conscientious objector to the war, the invasion of China, and that's why he was punished and sent to the front, because he refused to fight.
That's right.
His reward for that was being shot in the head and going left to go blind.
It's lovely, isn't it? Yeah.
Yeah. So this was really, and he was only 21 at that time. So it shows you kind of what a pioneering spirit he had. And then he went from that to, pioneering and then, developing a whole association of acupuncture for blind people. So really quite an extraordinary character.
Yes. I think in terms of Mr. Fukushima, I think that's exactly right. And he was well known for his very strong personality. And when he would set his mind to something, he would pursue it until it was accomplished. And so, so I think that really was his great strength in forming the Toyohari Association.
I think that leads me on to a question, really, because the way blind people approach palpation or looking diagnosis, obviously, is going to be completely different to the way we expect to do it. And
Yes.
there's a term in Toyohari called luster. They talk about the luster of the skin as something that you feel, or rather than something you see. Can you say anything about that? What does luster mean clinically?
Yeah, luster is a reflection of the vitality coming off the patient. And so if there's a good quality luster, and that would mean for us who are visual, that you might see a healthy glow off the skin. But if you're non-visual, as an aside, it's interesting, some of the people who are visually impaired still say they perceive luster almost as a visual perception, even though they're not using their sight to perceive that. It's quite mysterious to me. But then you're able to feel a life, a vitality that comes off the skin. There's certainly a quality to the skin that gives it that sort of a springiness, as though it's filled with this vitality. And there's not when you palpate some skin that does not have good luster, you can feel sort of a dryness. You can feel a depressed feeling, or there's a lack of this feeling of good life force in that tissue. And that's what we describe as luster. And those people who are visually impaired seem to be far more skilled at perceiving that through palpation than us who are using our sight as well.
Okay, but I think it's not impossible to learn, is it? If you're sighted, it's not like you can't feel luster with your fingers. Maybe.
Absolutely true. Yes.
Yeah. What's coming across then is a kind of subtlety of treatment, like subtlety of palpation. And earlier on, you mentioned subtlety of needling, what we call touch needling. So can you tell our audience something about touch needling? What is it?
Well, early on, needling wasn't just touch needling in the Toyohari Association. And so like other Meridian therapy schools, needles were inserted very superficially, but then they were inserted, sometimes retained, sometimes removed immediately, depending on the response in the patient via their pulse or other findings. But over time, Fukushima, Kozato, other practitioners, senior practitioners over the years, Mr. Takai, Mr. Yanagishira, etc., they would find that they didn't actually need to break the skin with the needle, that bringing the tip of the needle in touch, in contact with the skin, with the acupuncture point, and developing the ability to retain your mind, your intent on the tip of the needle in this sort of light and open focused way enabled a really wonderful and perhaps a better chi response in the patient than just that actually inserting and breaking the skin with the needle. So over time, this developed greater and greater sensitivity and awareness to these more subtle needling techniques. But as we have learned over the years, practicing this style, your ability to sense what's happening in the patient through the tip of the needle is remarkable as we develop our skills. When we keep our intent on the tip of the needle, we could really feel the arrival of the chi. We could feel when it reaches its peak. We can feel when it starts going down again. We can feel when the needle tip is deep enough or not deep enough to acquire the chi. We can feel if our technique is rough or smooth. And all these things that we learn, the better we get at that, the more able we are to integrate our intention at the tip of the needle with what the patient needs, the better reaction the patient has in terms of their health, their recovery, etc.
So it sounds like what you're saying is that you are learning how to, because you're not feeling these things kind of like just the tip of the needle being too deep or too shallow, because we're talking about just resting the tip of the needle on the skin. So what you're talking about is autonomic reactions in yourself that you're becoming aware of that are harmonizing with autonomic reactions in the patient. So there's a kind of interface through the needle between your chi and the practitioners. Is that right? Your chi and the patients, sorry.
There's a perception that we learn over time that we can feel through the needle. The needle becomes an extension of us. It becomes an extension of our heart and of our mind. So when we are utilizing the needle well, skillfully, we are then able to feel with our own heart, with our own mind, what's changing in the patient. And by doing that, we are finely and acutely attuned to the patient. We then know how much they need, how little they need, when to retain the needle, when to go deeper, when to go more superficial, when to remove the needle. All the different changes that need to happen based on our connection, like you said, autonomic connection between our perception and what's taking place within the patient. It's quite remarkable, really.
It is. I mean, when I learnt Toyohari for the first time, I felt like I had found what it was that I imagined acupuncture to be when I first went to study it. But when I first went to study it, and particularly after I'd been in China for a while, I felt it was a little bit mechanical. But when I came to Toyohari, I felt it was more like magic.
Yes.
Yeah,
it is like magic. Yes.
Yeah.
Yeah, and that only gets deeper and more refined the more years we study and practice it. And so, like so many of the higher arts that you've seen practiced, and I would say particularly in Japan, there's this emphasis on always going deeper, always getting more skillful. So we're not trying to learn new tricks all the time. We're trying to expand and deepen our understanding of what we already learned, what we already know in our practicing.
Well, I mean, I think that's very interesting, because from the conversation we're having, if people are watching this, they're thinking, God, that must be really hard to learn. That must be so difficult. However would you learn to perceive chi through the needle? So how do they teach you? How do we learn Toyohari?
Toyohari has a unique study method that Mr. Kozato, one of the originators of the group, developed. And in it, we have a group of practitioners. The minimum is 3, where one lies down on the treatment table as the model. One holds the pulse or the abdomen to give feedback. And the third one actually does the point location and the needling. Through this method, both the person on the pulse and the model can give feedback to the person doing the point location and the needling to tell them when it's right on or it's a little off, when they're doing something that's affecting their needling in a positive way or affecting their needling in a negative way. And in that way, we're able to speed up the learning process so that you realize, oh, right now, when my needle tip is touching the skin, but my shoulders are up towards my ears, the pulse got harder. I probably shouldn't do that. So let me try relaxing my shoulders and see what happens now. Then the pulse feeler, the person on the pulse says, oh yeah, now the pulse is much softer and more relaxed. That's good. And then I advance the needle and I feel like I'm touching something, but I don't know what it is. But something feels like it's connecting with the needle or drawing the needle in. And the practitioner holding the pulse says, oh yeah, now I'm feeling like the chi is arriving. And so suddenly the person doing the needling says, oh, so that's what it feels like when the chi arrives. And the model might say, yeah, that feels really good. I feel warmth in my leg or something like that. And then again, the person doing the needling might say, oh, so now I get it. When this happens and I feel this in my body and the person feeling the pulse confirms it, that's when the chi's arriving. Now I have a better understanding.
So what you're describing is a hack, basically. It's a learning hack. Because if you had to do this on your own in a practice, it might take you 20 or 30 or 40 years to master those kinds of cues from the body, like when you got the needling right or when you got it wrong. But when you got someone there, it's like a dual control car. It's like having a driving instructor in the car next to you saying, okay, just a little bit more gas and a little bit, just push the clutch in. Okay, now change gear. So you're getting this kind of in your ear instruction all the time about when you get it right or when you get it wrong, which enables your learning arc to be much shorter.
That's correct. Yes, and this carries out for all aspects of what we do. So we can utilize this method, this Kozato method, when we're trying to understand the diagnosis and forming what we call the show or pattern confirmation for how to treat the patient. And we could do it when we're locating the point. So we look for what's called a live point. So basically, it's not just the anatomical location of an acupuncture point, but where we feel like we could most, where the point is most accessible, where we could have the greatest connection and response in the patient at that location. Well, the one person is palpating and lightly, very lightly stroking the meridian to locate the point. The person on the pulse and the model can say, oh yeah, that feels right. Now you're on the point. Or wait a second, I think you're off the meridian even. Why don't you go down more towards the bottom of the sole of the foot or something? And maybe that's more closer to where the meridian is. And then, oh yeah, you just passed a really good location. I could feel the change in the pulse. Back up, 2 millimeters. There it is. And that confirmation really helps your fingers to understand what it feels like to locate a live point. That live point is very important because when we're on the correct live point, we could affect the greatest amount of change in the patient with our needling.
So actually, this Kozato method is like a learning hack, not just for needling, but for point location and also for diagnosis. So it's a kind of, you're always being guided in a kind of group way.
That's right. So the diagnosis is a little different. So what we might do in our group of at least 3 is that each one of us will take turns palpating the abdomen, palpating the channels, palpating the pulse, doing a looking and listening diagnosis, and comparing with one another what we're finding along the way. What we like to do in our study group here in Seattle, because we have a study group that meets monthly, the Northwest branch of the Toyohari Association of North America. And what we like to do is kind of not share information only until a certain point. And so we might each go and palpate the channels and each go and palpate the abdomen. And then we get an idea in our own heads as to what we think we found. And after everybody's done it, then we might compare notes and say, well, I thought the lung meridian and the kidney meridian were the most vacuous, but the gallbladder channel, boy, did that feel excess to me. And the other person might say, well, I felt the lung, but I thought the spleen was really deficient. I didn't even notice the kidney, etc. And we might discuss this a while. And the same thing with an abdominal finding when we palpate the abdomen until we find a consensus. And if we don't have a consensus, there's ways of helping to hone that in. We go through that with the channel palpation, with the abdominal palpation, and then with the pulse. And we usually save the pulse for last. We'll feel the qualities of the pulse, whether it's slow or fast, sinking or floating, excess or deficient. And we'll feel comparisons of the 6 positions of the pulse, where we compare, say, the lung and the heart, and the spleen and the liver, the kidney and the liver, etc., to get a sense of what feels the weakest and what might feel the strongest. And then we put all that information together to form our pattern of treatment, our pattern of diagnosis, or show confirmation, we call it. But by comparing with one another what we're all finding, and then looking at it more closely, if there's disagreement, let's see what we can do to find agreement until we all are on the same page and say, yeah, this is a kidney show. I had no doubts all along. I knew it was a kidney show right from the beginning. And then we could go ahead and treat for the kidney imbalance.
So what you're saying actually is that there are 2 kinds of pulse diagnosis in Toyohari, and one is like a pulse quality comparison. So you're diagnosing the quality of the pulses, and it sounds like you're looking for very few pairs, just floating, sinking, rapid, slow, strong or weak. And then you're also talking about pulse comparison diagnosis. So you're comparing the positions on either side of the pulse, like you're comparing heart and lung or spleen and liver. So you've got two different kinds of pulse diagnosis going on. I mean, what's the difference? What does pulse quality diagnosis tell you?
So the basic qualities, so that would be the fast, slow, floating or sinking, excess or deficient, that will tell you what kind of techniques you might need to apply with the needles. So if it's more deficient, you're thinking you're going to be applying more tonification or supplementation technique. If it's floating, you're going to think you're going to be needling more superficially rather than sinking when you might needle more deeply on a relative scale.
Mm.
And then if it's more rapid, then you might think the needling is going to have to be a little bit more rapid, quicker in your whole technique. And if it's slower, then you might take longer in order for the chi to fully arrive and then remove the needle. So those qualities, those basic qualities, indicate needling techniques that you might employ. The 6-position comparison diagnosis really helps with determining what that show pattern is. So then if I'm feeling for those different strengths, like we said, the lung versus heart, the spleen versus liver, then we might say, oh, the lung feels weaker to me than the heart position. Okay, I note that. The spleen position also feels kind of weak, and maybe it feels weaker than both the liver and the kidney. Therefore, right now I'm thinking I might be treating the lung show as primary. And I don't know if you want to go into this, but we're looking at it as an analysis based on Nanjing 69. So the 69th chapter of the Nanjing, which basically says, with deficiency, you treat the mother. With excess, you treat the son, or child, excuse me, gender neutral. In that sense, then, if we have a lung deficiency, which is metal, we would treat the lung meridian, and we'd also treat its mother, or the earth, which is the spleen meridian. So that's the primary pattern of treatment that we would arrive at through the pulse, through the abdomen, through the channels, etc.
Okay, so it's a 5-element form or 5-phase form of acupuncture diagnosis. So in some ways, acupuncture's diagnosis is relatively simple because you have limited options. There are only 5 elements.
That's correct.
And actually in Toyohari, we don't treat the heart channel very much because we don't come across heart deficiency patterns very often in 5-element thinking. Why is that?
We tend to think that we will treat for a heart pattern if someone has a true cardiac condition. And sometimes if there are other sorts of psychosomatic conditions, or consciousness issues, then there may be times where the heart channel could be treated. But since most cardiac conditions are not coming to the acupuncture clinic, we're not seeing people as often in acute cardiac distress or something like that.
Well, I think that maybe I should ask you, because people are bound to know, I mean, it sounds all very subtle and you're talking about all this kind of diagnosis. How would you treat me for shoulder pain? If I came in and I had shoulder pain, what would you do?
Well, the first thing to understand is how Toyohari treatments are kind of broken down. So the most important aspect of it is what we call root treatment. And in root treatment, we're trying to find the core underlying yin channel imbalance. So there we're looking for the primary deficiency and or excess in the yin meridians. Once we determine that through our diagnosis and show confirmation, we might say, oh, Oran, you've got a kidney deficiency imbalance. And therefore, I'm going to go, and the first thing I'm going to do is treat your kidney channel and its mother. And so then I might treat the kidney 7, and I might treat lung 5 or lung 8. We then look at the controlling cycle, or the sokoku, and so we might look at what's happening in the earth now because we treated water, Earth is controlling. And so we might say, what's happening on the spleen channel? And we could treat that, either deficiency, excess, or what we call, or something to help smooth it along, what we call wa, or harmonizing on the spleen meridian. And that constitutes the yin channels of the root treatment. We then go and feel what's happening with the yang channels, and we again regulate and balance those by looking for deficiency and excess in the various yang channels. After we do those two steps, then we say we've completed the root treatment. Now, the root treatment is the most important part of our treatment form, and that's because when done correctly, it will support the overall well-being, the health, and the ability to recover for the patient. So it really supports the patient's own self-healing capabilities. So ideally, as Mr. Yanagisha would say, 90% of what we do should be root treatment. The rest of it, what we do for symptom support or symptom treatment, should really only be about 10%. But that's when we get to the skill level that Mr. Yanagisha was at. At any rate, after that, we then have a number of supportive or treatments. And by that, we mean things that also support the root treatment. And so we have what's called the naso treatment. And naso is treating in the area of this cervical brachial region and the supraclavicular area and up through the neck and through the upper back out to the shoulder. Someone coming in with shoulder pain would certainly receive treatment in that naso region. And that would include treating around where the shoulder problem is, but also in adjacent tissue or adjacent areas that might imply some relief for the shoulder problem. We want to, for a shoulder issue, we might want to isolate which meridian is most involved in that. So say there's pain in towards the back in the scapular region, we might think it's small intestine channel, and there's various ways we could come about determining that. And so we could think about how will I best approach treating the shoulder? Well, if it's an acute shoulder pain and it's on the small intestine meridian, we can use what's called the midday, midnight, or Shigo treatment approach, in which case we could say, oh, it's isolated on one meridian, the small intestine, it's on one side. Therefore, I'm going to go to the opposite side of the body from where the shoulder pain is and look on the midday, midnight relationship of the Chinese clock, and that would be the liver channel. And so here, in this case, we could treat the liver channel and see if it relieves the acute shoulder pain on the opposite side, small intestine channel. Another way is we can use the extraordinary vessel treatment, what we call Kike.
Before you go into Kike, I'd just like to clarify for our viewers about Shigo treatment. So if someone had small intestine pain, you would look on the liver channel for one point, maybe around liver 5.
That's right.
Then you would do touch needling on that point, and you're going to hold that for a while. And that would be enough as a branch treatment to create some range of movement improvement.
And we would do the touch needling with a special needle, though. It's a number 30 gold needle, so that it has an extra amplified tonification ability. And we would hold the needle there, and at the same time, we could ask the patient to move their shoulder around until they feel some relief. Once they feel that, oh, it's not hurting so much, and oh, I have better range of motion now than I did before you did this needle. Once we feel that, then we stop. Then we could say, okay, that's enough Shigo treatment. And we would remove the needle at the liver 5, for instance. So it can be a very effective treatment for acute type of shoulder pain.
So you were going to talk about using the 8 extras and as another possibility for branch treatment.
That's right. So say the shoulder pain is not within the last couple of weeks, but has been going on for 6 months, a year, whatever. It's a more chronic problem. You might not think that the Shigo treatment is going to be as effective. And instead, you might try the Kike or extraordinary vessel treatment. So we utilize polarity agents to treat the 8 extraordinary vessels in Toyohari. And those could be a number of different things. People might be familiar with the ion pumping cords, and those were a copper wire with diode in one end so that the stream of electrons moved in one direction. This offers a polarity. In our system, we use copper and zinc discs that we apply to the master and couple points on the 8 extraordinary vessels. And so in this situation with the shoulder pain that's on the small intestine channel, we might apply the copper disc that has a positive or plus influence on small intestine 3, and we might apply on the same side as the shoulder pain, and we might apply the zinc disc, which has a minus or a negative charge influence on that point, on the bladder 62 point on the same side as the shoulder pain. And so by doing this, we set up that polarity relationship between the master and couple points. Again, we could have the patient move their shoulder and see if there's any relief in pain and increased range of motion, and see how that improves. After we remove the discs, we tend to apply direct or OQ MOXIBUSTION or Tenotsuku MOXIBUSTION on the points. So we might apply 5 pieces at small intestine 3 and 3 pieces at bladder 62, again offering a polarity or a difference with the way we treat the master point versus the couple point. This has a greater effect on alleviating symptoms.
And it's like the MOXIBUSTION consolidates the effect of the polarity treatment. Yeah,
that's right. And I think of the MOXIBUSTION as affecting not only the chi but the blood level, so that might have even a greater consolidating effect.
Are there any other ways that you would treat shoulder pain?
Well, sometimes if it's very severe and stubborn or hard to treat, we might look at thinking about shiraku or microbleeding. We could look at microbleeding on the Jingwell point of the channel that's affected, or we could look at doing local microbleeding with or without applying cups as well. So this is another effective way of symptom control within Toyohari, microbleeding. We could also, or shiraku, we could also think about things like applying press tack or intradermal needle locally, and that can sometimes be effective. We even, we could do local MOXIBUSTION in the area of pain. That can be very effective. And we even will occasionally retain needles, what's called chishin needling, where we do light insertion in an area of discomfort to relieve that. So that could be done as well.
What you're describing is a very broad repertoire of branch treatments, but all underpinned by an emphasis on root treatment.
That's correct. So all the branch treatments and supportive treatments, remember I mentioned that NASO, and sometimes we could think of the Kike extraordinary vessel treatment as supportive treatment as well. All of them always with the mind and the eye on maintaining and supporting the root treatment. So you never want to dissipate what you did in the root treatment. You always want to encourage and support it. So you're still thinking about that, even if we're applying a local treatment. Overall, by the time treatment is over, you've done your root treatment, you've done your supportive and your branch treatment elements. When you go back and repalpate the abdomen and you repalpate the meridians and you repalpate the pulse, it should be better. It should be better than even it was right after root treatment. It should continually be improving as treatment goes along. That's an effective treatment.
Right, so pulse taking is not something you do and then you kind of forget about until the end of the treatment. It's something that you're monitoring all the time.
That's a very important point. Yes, every needle, every time we do needling and root treatment, we go back and recheck the pulse. We want to make sure that the pulse quality has improved, and that in the 6 position comparison, that there's some change. So if you were kidney deficient before, after I needle kidney 7, there should be some change in the kidney position on the pulse. And so we are constantly monitoring the pulse throughout treatment to indicate that the patient is responding favorably. The same thing with the abdomen. We should recheck the abdomen through treatment too, to again ensure that the patient is responding favorably and they'll have a good clinical outcome. This is prognosis right there.
Right. Okay, so it's prognosis in terms of this can tell you how things are going to go in the future.
That's correct, because if you're getting a really favorable response in the patient in their pulse and abdomen, you could feel confident that when they go home and even a number of days later, they will still be improving. Their symptomology will improve. As a matter of fact, often I tell my patients, it's not uncommon for them to get off the table and say, oh, I feel better. But I often tell them and remind them, okay, see where you're at in 24 hours, in 48 hours, because that's when you really feel the most significant changes over the next 24, 48 hours. And that's important to note, because then the patient will have confidence into saying, oh, okay, I feel pretty good right now, better than when I walked into the clinic, but in the next few days, I'll feel even better. That's great. And then I want more of that. This is good.
It sounds like it's all very light, what you're doing. You're doing touch needling, you're doing tiny MOXIBUSTION cones, you're doing, if you're doing bloodletting, it sounds like you do it quite rarely, but it's microbleeding, it's very subtle. So it sounds like this is all kind of quite nice for the patient. Is that right?
That's right. And that's a very important part of this treatment. We're always working with an eye on bringing patient comfort. So this will facilitate their flow of qi, right? We want to augment and support their qi flow. Well, that includes a very comfortable reception when they get into our clinic. That includes a very comfortable table that they lie down on. But most important, our confidence and their confidence in what they're perceiving or receiving, When we touch them, we want them to feel reassured, grounded, and taken care of. So our touch has to be a touch of confidence and knowing, right? So when we bring our hands into a person, that's very personal. You don't get any more intimate than touching a person's belly, right? That is a very personal contact, and you need to have a good rapport to make sure that the patient is comfortable with what you're offering and that they receive it well. If they don't receive it well, the therapy will not be as effective. So we make them comfortable. We bring from our hearts, from our spirits, a place of compassion. Our goal is to relieve suffering, right? And so we amplify that in our own clinic settings. And when we when we first greet the patient, they're welcomed in. And then we explain how the treatment will go about. And when they lie down on the treatment table, and you might take their pulse quality and you feel their abdomen, there's a place of trust. They can feel our heart extend out in a compassionate way that allows them to be comfortable. This is very important in the healing environment. And I think Toyohari offers it up beautifully, because the subtlety, the gentleness, the kindness that's transmitted. Mr. Takai, who was president of the Toyohari Association for a number of years, he said, "Qi is love." And I think that's beautiful. It really is. We're accentuating the qi in the patient, and by doing that, they're feeling cared for. They're feeling a sense of well-being right there in the clinic and when they walk out and go home and about their business.
So where can people learn this stuff?
Well, there are opportunities to study all over the world, really, but the main branches of the Toyohari Association are in Japan, in Australasia, in Europe and the UK, and also in North America, the United States and Canada. We offer training programs in all these various locations. So at TANA, where I'm president, we offer training locations at this point primarily on the East Coast and on the West Coast. So we have offered training programs many times in both Seattle, Washington, and in Portland, Oregon. We are offered many training programs in the Washington, D.C. area on the East Coast, and in Florida, etc. So there are many opportunities in North America. The same thing throughout Europe. Stephen Birch and Junko Ida, very important people in the development and the outreach of Toyohari throughout the world, have offered trainings in places like Israel, in Brazil, as well as throughout Europe. There are trainings in Australia, in the major cities, also in New Zealand. And Oran, I don't know what you're doing there in Kuala Lumpur, but perhaps you offer some trainings there as well.
In terms of the cost in the US, is it very expensive to study? And is it a very long, in terms of commitment, is it a very long, is it a weekend course? Is it full-time? Is it part-time?
We break it up over 9 weekends. So it's an 18-day course in total in North America. And we break it up over 9 weekends, 1 weekend per month. So it's a 9-month commitment.
Okay.
After that, though, we offer ongoing continued support through our monthly study groups and reaching out to the recent graduate students to help them along so that they can feel more confident in their burgeoning skills.
Why is Toyohari relevant today? I guess in some ways you've answered that because you've talked about love, but is there anything else that you'd like to say?
I think that at this point in time when so many of us are working, I don't mean this only during the coronavirus crisis that we're all living through at this moment, but in general, we are doing so much more work in front of computers, sitting at desks, indoors. We're not hard laborers like we used to be. Some people still do. They're in the construction trades or something like that. But many people sit in front of their computers for long periods of time. Well, this leads to more and more deficiencies or weaknesses within the system. And a system like Toyohari is very good at supporting that, at rebuilding the patient who gets depleted by these activities. We're all stuck on social media as well, and all these other times we're interfacing with a device. But I actually think that's a little bit also simplistic in the sense that, yes, I think Toyohari is wonderful for this time, this day and age, for where people are at, because we are more sedentary in a way. But I want to also say that we can treat the hardened construction worker who comes in with acute low back pain, no problem. I don't think those issues are without or outside of the scale of what we treat. Basically, I think I speak for all of us. We treat anybody and everybody who walks into our door, no matter what the disorder is that they're presenting. So it's very timely, and I think it always has been, really.
As you've described it, Toyohari is a very subtle therapy, but it can treat a range of conditions. But it sounds like people are getting more sensitive than they used to be anyway. And what is it that makes people sensitive, and what is it that makes people respond so well to Toyohari?
It could be anything from people who have had traumatic experiences in their life, physical, emotional, psychological traumas. And I think that we're just seeing more people like that coming to our clinics. Treating a sensitive patient is a whole interesting and different ball of wax in a way, because you have to be extremely careful as to how you go about treating them. We have various tools, not just the standard filiform needle. We have teishins and enshins that we can utilize for patients who are more sensitive and can't take a fine pointed needle. When we use those tools, we find great efficacy for the patients that are more sensitive. In addition, we hone down the treatments, so we're keeping it much more simple with a more sensitive patient, because they will receive what would be a small quantity for one person, they might receive as a much larger quantity because of their sensitivity, their openness. They're too open and vulnerable, and therefore information and stimulation that comes in is magnified.
I always describe this to my patients as bubblegum. Like when the needle touches the skin, I imagine in some ways like as if there was an expanding sphere. The needle, it's like a bubble gum. So with sensitive patients, you can't expand that sphere very far. It has to be very small. And if you expand it more, then they start, as you say, they start to get overloaded or overjangled.
Right, you can do them a great disservice by over-treating them. You have to be very aware of what you're doing and make sure that the patient is perceiving and receiving that properly, and that you haven't done too much.
So what you're saying is that these tools like the teishin and the enshin they still move chi, but they move chi much more subtly than a needle. So in those cases, you will switch to using those kind of tools.
That's correct. And I find that I treat more and more patients that way. And they love it. Patients love the effect of the Teishin and the Enshin, etc. It's a lot like treating children, right? With the Shoni Shin, the tools I use are primarily the Teishin, the Enshin, the Zanshin, maybe the Chokishin. But so it's very simple and a lighter type of approach, just like you would with a child.
Yeah, yes, indeed. Children are the most sensitive patients of all, aren't they?
That's right. Their chi is so easily moved.
Mm.
And that's what it is about sensitive patients. Their chi is easily moved. And so we have to be careful with how we go about doing that. Always with a mind of balance and not overdoing it. I also think that even patients that walk in with a very strong and what we call a jitsu demeanor, maybe they are landscapers or construction workers or laborers of some form, they still can be very sensitive to treatment. And you still need to be very aware with how you're going about treatment. Even if they come in, with, they're all banged up from their job, they have they have a problem with their knees and their lower backs and their necks and shoulders, everything, because of the work they do. You might think, I have to do stronger needling with these people. Not necessarily. They often are also very sensitive. So we just have to keep that in mind with everybody we meet, being aware of where their patient's at and meeting them there.
Well, Dan, thank you very much for that. That's a delightful interview. And I think that a lot of people are going to understand Toyohari much better as a technique which is very versatile and has a very broad repertoire of methods for engaging all kinds of patients, from children, sensitive patients, to robust workers, with all kinds of techniques. And in particular, you've described how much the practitioner's chi is interacting on a minute-by-minute basis with the chi of the patient. Not only that, but you've talked about this incredible study method, which is like a study hack for people to learn how to move chi better. So thank you very much. That's been a wonderful interview.
Thank you very much, Oran. I really appreciate the opportunity to share information about Toyohari with your listeners.
So thank you very much for watching. Please stay safe and well. This is Oran Kivity at sayoshi.com.